Hi, my name is Essie. I'll be your nurse today. I will perform hand hygiene and provide privacy. I have a doctor order to do a head to toe assessment on you. Is that fine?
Yes, ma'am.
Can you tell me your name and date of birth?
My name is Annabeth Walker, and my date of birth is 3/24/2002.
All right, can I check your wristband? Thank you. Can you tell me what brought you here today?
I have pain in my right shoulder.
You have pain in your right shoulder. Can you tell me what month it is?
It is February.
It's February. And what brought you here today was because you have the pain in your right shoulder.
Yes.
All right. I'm going to start off by doing looking at your head, and her head is symmetrical, midline of her body. Her skin is appropriate for her race. Can I palpate? Can I touch your hair?
Mm-hmm.
I'm gonna touch her head, make sure she don't have any bumps, lesions, or masses. All right. Are you able to turn your head from side to side?
Mm-hmm.
All right. I'm going to look in her ears. I don't see any redness or drainage.
Sorry.
All right. You're fine. Also, I'm going to, her eyes are symmetrical, midline to her body. Her nose is symmetrical. All of her facial features are symmetrical and midline to her body. All right, I'm going to check your pupils. So I'm going to shine a light in your eyes, okay? Usually I would place some of your, I'm going to do like this so I can check your reaction. So this is Perla, which is pupils equally reactive, round and reactive to light and accommodation. All right, here we go. One. Yep. One time. All right. Her eyes were equally round and reactive to light. They look like they was a size maybe 4, and then they shrunk down to a size maybe 3 when I shine it. So I'm gonna get you to look at that window for me and then look at this pen. I'm gonna see if her eyes accommodate. All right, now look at the pen for me. All right, thank you. So do you have a history of having headaches?
No,
Do you have trouble seeing? Do you wear glasses?
I don't.
Do you have trouble smelling?
I don't.
All right, her lips are pink and moist. I'm gonna get her to open up her mouth for me. Her oral mucosa is pink and moist and intact. Her teeth are white and healthy, and her gums are tightly snug around her teeth. I'm gonna look at her nasal cavity. It's pink and moist and intact. I'm going to check her nasal patency. It's a patency. So I'm gonna get you to hold down each nostril for me. All right, and then I'm gonna get you to touch the other side. Do you have trouble breathing?
Mm-hmm.
You don't have trouble swallowing?
Mm-hmm.
Right? Her trachea is midline to her body. Her neck is midline to her body. I'm going to check for JVD. So checking for JVD, the bed will be at a 45-degree angle. So I'm going to get you to turn your head. Right? Turn to the other side. No JVD noted. All right. Now I'm going to listen to your heart. And for the purpose of this video, I'm gonna do it on top of her clothes with her lungs and her heart sounds. Alright. I'll be in the second intercostal space, which is aortic valve. I'll move over laterally, which is pulmonic valve. Third intercostal space is Erb's point. Fourth intercostal space is tricuspid valve. And I'll get her to lift her breast up for me, and I'll listen to her mitral valve, which is mid-clavicular, and I'll listen here for a minute, aka apical pulse. All right. No adventitious sound noted. That's what I was listening with S1 and S2. With the diaphragm, I would turn over to the bell to listen to the heart murmurs, and I would go in the same direction that I listened for just S1 and S2. And also I would use the diaphragm and go right here in her epigastric region to listen for Bruitt. I may not be saying it right. Now I'm going to listen to her long sounds. Alright, once I touch you, take a deep breath for me. So this is her right side. So this will be her right upper lobe. Left upper lobe. Right middle lobe. Left middle lobe. Now I'm gonna get you to lean forward for me so I can listen to the back side. Alright. Left upper lobe. Right lower lobe. Left lower lobe. Left middle lobe. Right middle lobe. Now I'm going to get you to put your hand to the side. This is right anterior middle lobe. Right posterior middle lobe. Now go on this side. Left anterior middle lobe. Left posterior middle lobe. All right. Do you have a history of heart disease in your family?
I don't.
You don't. Do you have trouble breathing?
I have asthma.
You do have asthma. Okay. So I want to educate you on the turn, cough, deep breathe method. We use it to educate patients on how to remove excess mucus. What you'll do, you'll turn, take a deep breath, and cough. Can you do that for me? Okay. And you can just turn to each side. Also, I want to teach you about the incentive spirometer. You will breathe into that 10 times an hour. And it helps to do the same thing to remove excess mucus that's in your lungs.
Okay.
So, all right. I'm going to check for capillary refill. So, in this list in 2 seconds, I want to check for edema. No edema noted. Her skin is warm to touch. I want to check for capillary refill in her toes. Less than 2 seconds. I'm going to check for edema. No edema noted. She has her dorsalis pedis pulse, posterior tibial, popliteal pulse, radial pulse, brachial pulse, auxiliary pulse, femoral pulse, carotid pulse. So now what I want to do is range of motion. All right, so I'm going to use her elbow. So this is extension. That's supine. That's prone. But what I want to do is also do flexion. So we're going to bring your arm up. That's right. Now you're going to bring it down. That's extension. And I'm going to try to push it back, okay? That's hyperextension. All right, so I would do the same on both sides bilaterally. So what I want you to do is, I'm gonna hold and I want you to try to do flexion.
Okay.
You go. That's pulling. You strong. All right, and then you're gonna push against me.
Okay.
I'm pushing. Pull and push.
Okay.
All right. Now I want to do her wrist. So I'm going to say this is extension, and then you'll do like this. This is flexion. Go back up, flexion, and then you'll do hyperextension. All right. So now I'm gonna do pull and push with that. So I want you to do flexion for me with your wrist. All right. Now I'm gonna push. Then do hyperextension for me. Good. And I would do that bilaterally. All right. Now I want you to do. I'm gonna do the knee. So her being the way she is, that is extension. Now I want you to kick out. That's flexion. Now I want you to put it back at rest. That's extension. Kick it back. She said that's flexion. All right. So now I'm going to do your ankle. I want you to tilt your toe to the sky. That's plantar flexion. Now I'm gonna get you to rest it again. That's extension, point downward. That's dorsalis flexion. Alright, now I'm going to do pull and push for the bottom. I want you to try to do flexion. So, pull. Alright, and try to do flexion the other way. Alright, that's good. And it's grade 5 bilaterally for both. Now what I want you to do is stand up for me. I'm gonna check your gait. So you'll close your eyes for me. Good. Now I want you to do like heel to toe. You can take 4 steps back.
Backwards?
Not back. Just 4 steps forward. And then turn around. Heel to toe. Her gait a little impaired, but we're gonna make it. Alright. Also, my patient is well groomed. So, you can have a seat. Her nail bed is clean. Alright. I need to do an assessment on your stomach. So I'm going to look. I would, for the purpose of the video, of course she has her clothes on. I would inspect to make sure I don't see any abnormalities on her stomach. Now I'm going to listen. All right. This is her right lower lobe. I'm talking about right lower lobe, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And if I didn't hear anything, I would listen to each quadrant for at least 5 minutes. Do you have trouble using the restroom?
Mm-mm.
When was your last bowel movement?
Yesterday.
Alright, so everything is checking out fine. I want to educate you on the Glasgow scale, which it tests your motors, your verbal response, modal, verbal, and eye response. So your eyes were reacting to me, and you told me who you were, and your modals are working just fine. If you was less than an 8, that means you would have had a brain trauma injury. So it seems like everything is fine. I want to ask you some more questions that I may have not asked. Do you have trouble walking at all? Do you use any devices? You don't have trouble seeing, smelling, swallowing, no chest pain, no trouble going to the restroom, no trouble breathing. All right, and I think that is all, and I will let the daughter know. Thank you.
Thank you.